In this lecture, we are going to discuss Acyclovir from all aspects. So without wasting time, let's get started. Acyclovir, also known as acyclovir, and its brand name is Zovirex. This drug is used against the herpes simplex virus type 1 that causes the cold sores, herpes simplex virus type 2 that causes the genital infections, varicella-zoster virus that causes the chickenpox and the shingles, and it can also be used against the Epstein-Barr virus, but it's used against this virus really due to the upcoming resistance. Next, if we look at the pharmacokinetics, so these drugs can be given through three different routes: IV route, oral route, and the topical route. These drugs, acyclovir, distributes very well in our body. It can also be entered into the CSF, cerebrospinal fluid. So important thing, it can be used in the HSV, herpes simplex virus, encephalitis as well. And important, these drugs excrete from the body through the renal route. So kidney is the main organ through which this drug excrete from our body. Now, if we look at the mechanism of the acyclovir. So acyclovir is a guanosine analog. Guanosine analog. It means that acyclovir will be similar to the guanosine. Guanosine means sugar and the guanine, then it will become the guanosine. First of all, this drug acyclovir convert into the monophosphate acyclovir with the help of the enzyme, and that enzyme is the viral thymidine kinase. This enzyme add the phosphate group to the drug acyclovir, and after that another enzyme, that is the cellular kinase, add 2-phosphate group to the acyclovir. Now in that case you will see the acyl guano triphosphate. Similarly, deoxyguanosine triphosphate also be present in the cell. That is the normal nucleotide present in our cell. Now this is the drug having 3 phosphate group attached to it. Now there is a competition between the drug and the nucleotide that is present in our cell. Now the most important enzyme, that is the DNA polymerase. Now DNA polymerase adds the nucleoside in the DNA molecule. So in the DNA molecule you will see the sugar phosphate backbone, and in between these sugar you will see the presence of the nitrogenous bases. Adenine will be in front of the thymine, guanine will be in front of the cytosine. Now DNA polymerase will bind, if the DNA polymerase bind to this guanosine triphosphate, deoxyguanosine triphosphate, then it will be the normal. But if this DNA polymerase bind these drugs, then ultimately you will see when these drugs binds at one end of the DNA, then you will see the stoppage of the replication. Why? Because in that case there will be the no extra hydroxyl group present for the DNA elongation. So that is the important thing. So now this will be the stoppage of the replication of DNA, because at one side you will see the attachment of the drug. So that is why drugs will act similar to the guanosine triphosphate. So there is a competition between the drugs and the nucleotide, and that will be decided by the DNA polymerase. Next, if we look at the adverse effects. So adverse effects will be depend upon the route of administration. If the route is topical, then you can see the local irritation. If the route is oral, then you can see the headache, diarrhea, nausea, and the vomiting, and transient renal dysfunction, temporarily renal dysfunction caused in case of overdose of acyclovir. Next is if the route is IV, then you can see the delirium, tremor, hypotension, and the nephrotoxicity. This mostly happens in the dehydrated patients, When the patient is dehydrated, and if you inject the acyclovir in the bloodstream, then it can cause the nephrotoxicity in that case. So this is all about the acyclovir. But if you still have any question, you may ask in the comment section. Thank you so much.